Hello, I'm Dr. David Roberts from Manchester West Veterinary Hospital here in Ellisville, Missouri, and today we're going to talk to you a little bit about tick-transmitted diseases. What I tell people is that fleas are kind of a nuisance, but ticks are bad news. They actually can transmit very serious diseases, very hard to diagnose diseases. We see tons of these diseases in our area. This winter was very mild in the St. Louis area, and we're going to find that ticks, fleas, and other insects are going to be very plentiful this year. So we want to make sure that we take some precautions. We're going to talk a little bit about prevention. The first thing, though, we talk about is that a tick actually has mouth parts that are prong-like, and they glue themselves in. They actually have cementum on their mouth parts. So when they're in there, they're in there. So pulling a tick off flat out is probably not going to help you very much. What we usually do is we say take tweezers as such. If this is the head of the tick, what I do is I rock it side to side, side to side. You're pulling out these little prongy mouth parts a little bit at a time. So when you do that, you're going to get that head out of there, so you're not leaving behind something that's going to cause more of an infection. The best thing that I will tell you, though, is that preventing ticks is paramount, especially in our area. We use Frontline exclusively for ticks. It is still the #1 medication for ticks and fleas. This is the product that we use with our own dog Cruiser, and it's something that we use for all of our patients, especially for the tick-transmitted diseases. Tick-transmitted diseases, some you've heard of, some you haven't. Lyme disease, you probably have heard of, and Rocky Mountain spotted fever. But there's 3 other ones that we see in our area now. One is called Ehrlichia. It's probably the one we see the most. One is called Babesia, and the other is called Anaplasmosis. But they're all transmitted from these various forms of ticks that we see all throughout the Midwest and all over the country. What we tell people is that tick-transmitted diseases mostly go into the joints. What I usually see, this is a model of a knee joint. We see a lot of dogs that have arthritic changes in their knees, ankles, elbows, and wrists. And that is because of this bacteria, or these protozoas that float through the bloodstream. We can also see Lyme disease especially affect kidneys, and it can even get into the heart and affect that. We are treating a case of Lyme disease in a dog that has kidney failure as we speak. With Lyme disease, there is a vaccine, and the vaccine is very effective. It's been around for about a year now. About 10 years, and it seems to be very, very effective. But what I tell people when it comes to tick-transmitted diseases is they're really serious. Like I say, fleas are a pain. Ticks are significant. They cause serious disease. So prevent, use your products like Frontline. That is the best on the market. It doesn't matter who you speak to. When it comes to ticks, that is the best. So please get on the preventative sooner than later, because it's going to be a bad year, at least in our area. Thanks much. I'm Dr. David Roberts from Manchester West Veterinary Hospital.